Hello, I'm Jada Schrader, and this is my joint movement video for my kinesiology class. I just want to apologize in advance if my kitty cat makes a couple of features in this video. She is very interested in what I have to do on my phone. So I'll just get that out of the way to begin with. Sorry in advance if she tries to climb up all over my screen. Today I will be going over, she's about to do it right now, yeah. So today, we will be going over the ankle, knee, hip, shoulder, elbow, wrist, and the cervical spine joints. I will be naming the, specific correct anatomical name, the type of what I can't speak, but I apologize in advance for that as well if I don't pronounce these correctly. But the type of joint each joint is, specific movements, range of motion, and the degree of freedom for each joint. So let's get into it. So first we have the ankle joint. This is the talocrural joint. This is a hinge joint. The movements, we have two different movements. I'll go over the first one and then the next one. So the first is the dorsiflexion. This is movement in the sagittal plane around the mediolateral axis. So this is moving your foot so that your toes get closer to your knee, and I will give you an example of that. So it's essentially taking your foot and then moving it up this way. The next movement for your ankle is the plantar flexion. This is movement also in the sagittal plane around the mediolateral axis. Now this one is when your foot points down towards the ground, and I will show you that as well. So this one, you're taking your foot and you're pointing your toes downward. Now the ankle only has 1 degree of freedom, which makes it uniaxial. Next up we have the knee joint. This is called the tibiofemoral joint. This is a modified hinge joint, and there's 4 different movements for this one, so I will get into that. First up is the flexion. This is movement in the sagittal plane around the mediolateral axis. This is essentially just like doing a squat, and I'll show you that. It's literally just bending your knee so that you have a decreased angle between your lower leg and your upper leg. That looks kind of funny. The next movement that we have for the knee is extension. This is movement in the sagittal plane this time, still around the mediolateral axis though. And this is essentially just lifting up your leg and extending it at the knee. So I will show you that as well. You lift it up and then you straighten it out. The next movement we have is the internal and external rotation, but this is only when the knee is flexed. This is around the transverse plane, along the longitudinal axis. This is moving your foot away or towards your other leg. So I'll show you the internal one. So you go like this. This is the internal, and then this is the external. The knee has 2 degrees of freedom, so it is biaxial. Next up we have the hip joint. This is the coxofemoral joint. This is also known as a ball and socket joint. There are 6 different movements for this joint, and I'll do 2 of them at the same time, so I don't, Anyway. So we have the flexion and the extension. So this is movement in the sagittal plane around the mediolateral axis. This is kicking your leg forwards and backwards. I will show you that. So you are kicking your leg forwards and then kicking your leg backwards. But pretend that I did not bend my knee to do that, because I have limited space here in my room. The next 2 movements that we have is abduction and adduction. This is movement in the frontal plane around the anterior-posterior axis. This is moving the leg away from the midline and then moving it towards the midline. I will show you that. So this one is the abduction, going away, and then bringing it back is the adduction. The next two movements that we have for the hip is the internal and external rotation. So this is movement in the transverse plane along the longitudinal axis. So for this one, your knee is going to go towards the midline, but your foot's going to go away from your midline. And I will show you that. So this one, your knee's going to go this way, your foot goes that way, that's internal. For external, your knee's going to go the opposite way, and your foot's going to go that way. There are 3 degrees of freedom in the hip joint, so that makes it triaxial. Next up, we have the shoulder joint. This is the glenohumeral joint. This is also a ball and socket joint, but this one has 8 different movements. So the first, I will also be going 2 and 2 for these ones. So the first 2 are the flexion and the extension. This is movement in the sagittal plane around the mediolateral axis. This is raising your arm forward and raising it backwards. I will show you. This is raising it forwards and then raising it backwards. The next set of movements that we have for the shoulder is the abduction and adduction. So this is raising your arm up to the side, abduction, and then lowering it down is adduction. Then we have the internal and external rotation. This is the movement in the transverse plane along the longitudinal axis. This is pulling your bent arm towards your midline, that's internal, and then the external would be pulling it back away from your midline. Then we have the horizontal adduction and abduction. So this is moving your reached arm backwards, that's abduction, and then adduction would be pulling it back forward. There are 3 degrees of freedom for the shoulder, so this makes it triaxial. Next up is your funny bone, also known as your elbow joint, also known as the ulnar joint. This is a hinge joint. There are 2 movements for this one. There's the flexion and the extension. So the flexion would be sticking your arm out and then bending your elbow towards your body. And then the extension would be taking it from here and then extending it forward. There's only 1 degree of freedom, 1 degree of freedom, so this makes it uniaxial. Next up, we have the wrist joint. This is also known as the radiocarpal joint. The type of joint, it is a condyloid joint. There's 4 different movements for this. So the flexion and the extension, that's movement along the sagittal plane around the mediolateral axis. This would be bending your wrist down and then bending your wrist back up. Then we have the radial and ulnar deviation, adduction and abduction and adduction. So this is movement in the frontal plane around the anterior-posterior axis. So the abduction would be going this way, turning your wrist sideways that way, and then the adduction would be turning your wrist that way. There are 2 degrees of freedom for the wrist, so that makes it biaxial. And last but certainly not least, we have the cervical spine joints. These are the atlanto-occipital and the invertebral joints. So the atlanto-occipital are between the skull and the C1 vertebrae, and the invertebral joints are between the cervical vertebrae. So the type of joint, the atlanto-occipital is a condyloid joint, and the invertebral joints are plane joints. There are 4 different movements for the cervical spine joints. So the first two, that's the flexion and the extension, that's movement in the sagittal plane along the mediolateral axis. So this is bending your head forwards and backwards. Then we have the lateral flexion. This is movement in the frontal plane along the anterior-posterior axis. And this is putting your ear to your shoulder. Then we have the rotation at the atlantoaxial joint. This is movement in the transverse plane around the vertical axis, and this would be turning your head side to side. And the degrees of freedom. So the atlanto-occipital has 2 degrees of freedom, making it biaxial, and the invertebral joints have 3 degrees of freedom, making it triaxial. And that is the end of my joint movement video. I hope you loved it. I hope you liked it. I apologize for my pronunciations. I am a future PE teacher. I don't know all these big science words. So, thank you very much for enjoying the show.